Hello and welcome everyone to this week's Women's Health Tech Wednesdays. We love these and we have another exciting guest with us today that I am excited to introduce to you and look forward to having a chat today. So I'm Lisa Crimes. I'm with HITLAB as an Innovation Fellow. We have a full pack 30 minutes today. Before we jump into that, though, I want to remind everyone of a couple of things with HITLAB through the Breakthrough Alliance. The deadline for our Fall Innovators Challenge is coming up this week, so don't miss that. So if you're, have an AI solution that you're working with, either startup or enterprise, take a look at this, but don't miss the Innovators Challenge or the deadline this week. Now, for the exciting part, please welcome our guest today, Dr. Ami Bhatt from the American College of Cardiology. She's Chief Innovation Officer. Ami, so glad you're here, and I'm so excited to chat with you.
Thank you so much for having me. This is great. I've really loved my interactions with HITLAB, but I'm super excited to be here for Women's Health Tech today.
That's awesome. Well, let's just jump right in. Do you want to start by giving us a little bit about your background and maybe your journey and journey in healthcare and in technology?
Yeah, absolutely. So my journey, and some people may have heard this before, really started with the type of patients I care for. So I was taking care of adults with congenital heart disease. So these are people who were born at a young age with heart disease. And so the average age of my patient was kind of in their 20s when I first started practicing 15 years ago. And so really digitally forward population who also came a very long way to see me, because what I did was, pretty rare. There weren't a lot of us who were trained for that. And as a result, when telemedicine started to become more popular, especially for stroke care in New England, to be able to help diagnose stroke and treat it, I kind of raised my hand and said, hey, do you think you would let a cardiologist over here try it? And my patients and I fell in love with the concept of being able to be in touch more than once a year, to move from episodic care to continuous care. And we quickly realized that it wasn't enough to just see each other on a screen. It would also be great if they could send me information from their home about themselves, whether that was something I prescribed for them, like remote monitoring, or something they were doing on their own, like a blood pressure cuff. And so I really started to just meet the companies who are out there doing this kind of work. And, it's only 10 years ago that I started doing that, 2013, but boy, how far we have come. COVID was not good for many things, but it was really great for helping us understand that we can provide high quality, sustainable cardiovascular care in the communities where people live. And so that's kind of become my new mission and aligns with the mission of the American College of Cardiology.
I love that. And you're so right. COVID seems to have changed so many things for us in the last 2 years, just that acceleration. I love your background and really the way you've thought about this from what you've heard from the community and from your patients. Before we jump any further, I know Nina always asks this question, so I have to ask it as well, but I'd love to hear what you think in what actually women's health tech means to you.
Yeah, it's a great question. So I think the first thing we need to recognize is when we think about women's health tech, just because of the way the world has developed over hundreds of years, there has been a lot more emphasis on studying men than women, period. Nobody's at fault for that per se, but that's something that we are now working towards recognizing, which is there are gender differences across multiple, genders that really need to be studied better and understood better. But it also means that as we look at different populations, there are specific ways that we can actually help people accomplish the task of both preventive care and the treatment of in my case, cardiovascular disease, right? And so I think the goal of women's health tech is twofold in my mind. One is really orienting our technologies towards making sure that we are being inclusive and comprehensive in what we do. The second, I think, is thinking about the women who are actually doing the health tech work, right? And the innovators, and recognizing that. And we were, joking about this before. Jerry was on with his very young daughter. And there's no age that's too young to start exposing women to STEM and to thinking about becoming a health tech entrepreneur. And so I kind of think about both of those, and I encompass both of them when I think about women's health tech.
I love that. It's I have a daughter myself, and as she's continues to starting her own family too. It is STEM is so important. I love that you brought that up and brought in that perspective as well. Well, can you tell us a little bit about your position at ACC as Chief Innovation Officer, and specifically even your clinical background? How has that allowed you to bring that together with technology and excel there?
Absolutely. So I think just to speak to the ACC first, the innovation arm of the ACC is not distinct from the rest of the group. And in fact, our mission includes the word innovate. And so the entire college really is thinking about how do we move forward, and what does the future of cardiovascular care delivery look like, and how can we both be a part of that for our patients, be a group that is trusted for the community of people who are also invested in improving healthcare and healthcare delivery, and of course, education, which I think is kind of a key part of what we've always done. But ACC Innovation specifically, when we first started 6 years ago, my predecessor, I'm the second Chief Innovation Officer, my predecessor recognized, he said the digital transformation of cardiovascular care is coming, and we need to attack virtual care, remote monitoring, and then AI. These are the areas that are going to be there. And I just want to point out that was 6 years ago that the group that started at the American College of Cardiology recognized that, right? And so kudos to them for that. COVID really accelerated in the past 3 years to the point where those are still the areas that we focus on. It's very clear to us that cardiovascular care that's sustainable in the communities where people live, that is our North Star. But to do that, you need entrepreneurs, you need people who are in health tech industry, you need people who have large infrastructure. So the companies that are already out there who are now getting into health, we hear about them a lot, right? We also need the scientists, we need the clinicians, we need the investors, we need the VCs who are putting their money behind companies. And we need to make sure that all of these people are talking to each other with the end goal of, wow, we can create really great technologies, but can we create technologies that are usable, that are deliverable and implemented at the point of care to improve health? And that's where we come in, right? It's that last step of, we will meet with any of you and talk with you and co-develop with you and help make sure that together we are no longer working in silos, but instead really working to deliver things that are meaningful at the point of care. And I don't think any technology company that's out there says, I just want to sell stuff on the shelf. They're all there because they want to make healthcare better, right? And so yes, there's the business aspect, but the origin story for any good company is, I want to make a difference. And so our goal is to really try and help that. That's where my clinical expertise, I think, comes in. After being in the field for the past 20 years and practicing, I was outpatient director at Mass General for cardiology as well. You really see all the good that can be done, and then you see the inefficiencies of a healthcare system that grew from a different model, right? And so the need to change that model of care delivery, and the fact that we've really changed how technology develops. There is so much more opportunity for people with a good idea to make that happen. And that's different than only having a few companies who are in charge of developing technology over time, right? So we don't just live in the world of industry giants, we live in the world of brilliant people who are doing good things. So how do you bring all of that into the practice of cardiology? The one thing I saw as a clinician is we have to do that because the information overload is significant, because the advances in technology and even medical knowledge are significant. And if you don't have the ability to take all that data and put it together, if you don't have the ability to reach your patients, then you really can't achieve the kind of healthcare that's actually possible today. And so I think that's where my clinical experience drove me to say, I'm ready to take that next step and really see if we can pull this all together.
That's awesome. There's kind of a couple of things that jump out for me is one, cardiovascular touches really all aspects of a person. So, I love that you're thinking about that holistically, as well as the overall healthcare technology, or just healthcare ecosystem, and the intersection of all of that. So, and then ultimately data, right? Which is why we're ultimately have made all these advances are getting us to that point. So, love your perspective on that, and I think all of that is so crucial. So kind of going on to kind of just building off of that. And before I do that, I didn't remind everybody too that there is Q&A. So please pop in if you have questions. We will have time at the end. So please share any questions that you have, and I will be taking a look at those. But Ami, as a CEO, what are some of would you say, the overlooked aspects in digital transformation of healthcare that clinicians or health tech innovators need to keep an eye on?
Yeah. So I think there's probably three things. I think the first is, and we're getting better at it, so I'm not saying it's not happening, I think the patient voice. I think we can go all in on the patient voice in designing, in deciding which diseases should maybe be addressed first, in thinking about what does the patient need to know, and what can the patient sometimes do in the absence of their, in my case, cardiologist, but physician being present, right? So what does it look like to be healthy? What does it look like to manage your chronic disease? And then what does it look like to do that with your clinical team? Those are different things. And so I think we really, we have an opportunity, especially now, to go all in with the patient voice and really make sure that that is a part of how we design, right? We talk about human-centered design, but it's not the human just as a consumer. It's the human as the person who experiences these diseases, right? And so I think that's probably our biggest opportunity right now. Then I think if you look at the clinical side, I think an understanding that, we say artificial intelligence, and the word artifice means deceit from like Middle English, right? And then we're like, why don't you trust AI? I'm like, well, you use the word deceit in how you named it. So there may be some issues. Not nobody's fault. That's where it started from. I think that the understanding, we like to call it collaborative intelligence. We have X amount of data. We can manipulate that data with computers to see patterns or trends or make suggestions based on guidelines that we know, and just offer that up to a clinician and a patient and say, hey, I'm noticing X for this group of people or this individual. What do you think? So we're not taking away autonomy from the clinician. We're not taking away the clinician-patient interaction. We're simply saying, there's a lot of data here, and I can probably process large amounts of data better than you can, individual physician. Let me help you. And so collaborative intelligence, I think, is number two. So first, patient voice. Number two, collaborative intelligence. And then I'll say number three, and let me just kind of go out on a limb a little bit and say, a little differently. I think there is a lot of value to starting to think about where the virtual reality industry is going, especially in terms of interventional care, because we see this in the surgical field. We know that the more you get to practice something in general, the better you get at it, right? If you're practicing in a good environment. But we also recognize that the areas that are most underserved are places oftentimes where you don't get to do the procedure as often. You haven't necessarily trained in the same place. If we can start really thinking about the future of virtual reality training and increasing people's comfort level with the intervention that they're doing, increasing the quality of what care they deliver, using that towards education, right? Not testing on paper to say, what would you expect next, surgeon, right? But rather saying, hey, put your hands on this. What would you do next? And not judging people, but rather showing them where the opportunities for growth are. I think that's actually going to improve healthcare in general. And I see a lot of women who are going into this field and starting to think about both AI, kind of number two, and data, or collaborative intelligence, and number three, virtual reality. And I would encourage the women to continue doing that.
I love all three of those. And I think I'm going to just start using collaborative intelligence so much because it just changes the conversation. It's not immediately, it's replacing something, which I do often say is that you're augmenting, you're using technology to enable and to increase, but collaborative intelligence is a great way to even tie all three of those together. But great perspective on all of that. Well, so think a little bit about maybe some of the work that you've done with partners, either large organizations or startups. From your experience, what specific advice would you have? Any different advice for them about their impact around community health? I know you've talked about this before a little bit about health equity and how that can help strengthen the relationship in the community. So maybe you can bring that in as well here.
Yeah. So two key things. The first is we can't walk into communities that need care and say, "Hi, I'm here to save you." That doesn't work. We've seen that time and again. What we can do is we can find community partners, and then we can use those community partnerships to more and more create kind of train the trainer models, right? Whatever it might be that you're doing, what you want to do is create sustainable use of your technology. And in order to do that, you need to be able to achieve health and digital literacy, right? You need to have good user experience. You need to have connectivity in some of these cases. So we can talk about that a little later or maybe at a future discussion because it's a large discussion. But at the end of the day, you really need a community partnership if you want to be sustainable. And so you have to, and community partners come in all different shapes and sizes. But I think that's an important part to think of. I'll come back to that in a minute when we talk about large organizations. Let me go to number two. For any company, and this is both for kind of equity and going into areas that need it, but just in general for your product or your team. If you're a small startup, an entrepreneur, focus. There is such an opportunity to say, I'm a bioperipheral, but wow, wouldn't it be great if I create my own platform? And if I create my own platform, shouldn't I have a telemedicine thing? And so then I need clinicians on that platform, and now I'm going to be a telemedicine. And all of a sudden, you're just completely diffuse and you're getting focus. What's the thing you can do and how deep can you do it? And then partner. And so I would say that's true for small. Now, for large institutions, everybody has an innovation arm now, right? So the question for the large institution is, again, the same thing. What is your mission? What is your focus? Because the company does 100 different things and you could innovate in any one of those areas, but what is your innovation group's mission? So I'd say focus is probably number one. And then number two, when we're specifically talking about the community, is you have to partner. Let me address that for a second. It is challenging to think about being sustainable by finding a different community partner in every community. How big do you define a community? How small? Is it global? Is it local?
Right.
And so I think there is value when we see large organizations that happen to have some sort of outreach, whether it's a standalone, store that they have in every community, whether it's a partnership already existing in every community. So ranging from, things like large pharmacy companies to other institutions that exist 7 miles from everybody's home to really great NGOs that have outreach and already created things in Africa, right? Doesn't matter what you're talking about. Partnering with those organizations, that's a great way to get really close into the community and do it in a way where you can actually see the scale of what you can do. So there is great value in local community partnerships should be done. If you're a bigger company who has the financial wherewithal to think about large scale, then I think things like the Bill and Melinda Gates Foundation or the CVS's or Walmart's or Best Buys, and again, I'm just using names, not that I support these organizations, but I think it's worth thinking about.
I love that. I think that great thoughts around that too, and bringing in that community voice. Great ideas. We do have one question from the audience, but let me switch for just, let me go on to my next one, and then I'll switch over and ask a quick one from the audience. Can you tell us a little bit about maybe some projects that are going on at the ACC that we might want to hear about, some innovation or innovative projects that you've been working on?
Yeah, so I came into this job in February of this year. And so we are kind of in the midst of talking to several companies about helping them co-develop and really what they can do. And the arenas that we're focused on right now is, one is screening. So upstream in the preventative stage, looking at two things. One is, can you screen individuals who may be higher risk for cardiovascular disease and really up their knowledge about it, as well as their attention to it, and then their treatment of it, right, with their clinical team. The second is screening for all the times that people have chest symptoms and are so anxious about it, but could be reassured earlier that it's not this. And we have to think about that. Chest pain is one of the most common diagnoses that people present to an emergency room for. And so we really need to start understanding, can you screen to reassure? And can you screen to diagnose earlier? And so screening is an area we're really focused in innovation. The second is actually virtual reality education, along with our education partners at ACC, is an area that we're investigating and really think is important to bringing education into the future as well, and how to work with companies who are working on that. And then I think the third is exactly what I just mentioned, really looking at how do you get into the communities where people live, where there's some structure for healthcare. I'll give one example, and this is actually just this is an organization right now that we're friends with, so not partnering with yet, that out there. But City Block Health is doing a beautiful job of really getting out into the community and providing that primary care. And so organizations like that, like Iora Health, who has now moved on to become One Medical and then further, but those kind of organizations that say we can create a structure to find the people who have less access and give them more access. How do we partner with them? I have a good friend who works in the VA system, again, another place. And so those are some of the areas we're thinking about for co-development. And then separately, I will say, we're really interested in partnering and talking with the FDA about, as people are coming through to get FDA approval, can we help make sure that their really awesome technology gets implemented? Can we give advice earlier on? Partnering with the NIH, thinking about not just the science behind AI, but the implementation science behind AI. Is it making a difference? Where do we make a difference? How do we make things better? And so our partnerships, the ATA, the AMA, CTA, lots of really great partners. But again, with each one of them, thinking about what do they do that's good and strong in their arena. So I'll take the Consumer Technology Association, for example, as the last one, and we can get to the question. But we partnered with them to really say, for consumer cardiovascular technology, what are the clinical needs that we think a technology should include? And so last year, the team at ACC, actually before I came on, partnered with them for consumer cardiovascular technology standards. And we're going to, revisit those every 12 to 18 months and think about what else we should add. So again, I think partnerships, synergies, breaking down silos, working with the large organizations that are doing great work to say, how can we help you with our clinical knowledge, with our expertise? And then companies, big or small, for co-development. How can we plan to do this in a way that what you're doing is implemented successfully?
Well, that definitely sounds like a theme, is partnerships, and that no one person or organization is going to, solve all the challenges that are out there. I'm going to ask you a question from the audience that ties in really nicely to what you just said too. Is so this is from Tom Petersall, if I said the last name correctly. Imagining prevention and recognizing the behavioral challenges. Is there something specific that you wish patients would be better informed about a decade? Am I reading that informed about before they show up at your office? And that is along the lines of what you were just talking about. But he says, so something like a wearable or test that would be an excellent first step in changing our cardiovascular health awareness and prevention journey.
Yeah. So I think if you are, so there's two different categories. One is if you're seeing your primary care, right? And what can you do to be aware? So I think knowing your numbers is really important. Yeah. And so both when you see the doctor, but if you're only seeing the doctor once a year, you should probably know your blood pressure more than once a year. So I think the standard things that we say, knowing your blood pressure, knowing your cholesterol levels, knowing your sugar levels or risk of diabetes, right? Knowing your optimal weight and what you're doing to achieve it. If you during COVID happen to have gained X amount of pounds, like certain people on this Zoom, not you. But I think knowing those numbers, knowing what range you should be in and how you're going to get there, that's a conversation to have with your primary care physician. If you're seeing a cardiologist, from a preventive aspect, with your cardiologist. Now, if you're interested in wearables and other remote monitoring, what I would do is I would ask your cardiologist, for the disease that I have, is it helpful if I monitor? I will tell you, I love the idea of digital prescription, which is, I think you're having abnormal rhythms, therefore I would like you to wear this. I will not make a decision based on a wearable alone, but does it possibly give me some additional information? Increasingly, we're showing them succeeding at trials that show us, how much faith can you put in each of these wearables.
Right.
And we work really hard at the ACC, along with our colleagues AMA and other places, to start to really say, hey, these are things that we trust. These are things that are still being evaluated.
Right.
So again, everything is with a little bit of a grain of salt. So I would say the most important thing to me, though, is if you could know your numbers, blood pressure, cholesterol, diabetes or sugar levels, right? Risk of diabetes, and weight. If you could do those things, and if you're not sure what that is, ask your doctors, because they can all tell you what the right goal is and how to get there and make a plan. I think that's the most important. The wearables are kind of like the icing on the cake. And I would just, ask if it would be helpful. Sometimes it's information that's not helpful, in which case you're worrying yourself, right? Why does my heart rate go up and down
Which
all
is
day
the part
long?
that you talked about earlier, right?
Exactly. Because my heart rate goes up and
That's
down all day
awesome.
long because it does. And that's heart rate variability is normal. And so, I say don't over monitor either. Just know what's healthy and try and aim for that. And then as we know more, we will try and offer more.
That's awesome. Well, this time went way too quickly. I feel like I could have a couple more hours with you. And hopefully we will have that opportunity in the future. So we're at the end of our time. I thank you so much for the conversation, and do look forward to seeing you again.
Wonderful. Thank you so much for having me. I can't believe it's 1 o'clock already. And to anybody who is watching now or later, please feel free to reach out to me on LinkedIn. I always love having more conversations.
Thank you. Have a great afternoon.
Thanks.
So thanks, everyone. And next week we will continue the conversation. So be sure to check that out on LinkedIn or directly on Eventbrite, and remember the Breakthrough Alliance. Thanks again for joining this week's Women's Health Tech Wednesday. And again, thank you, Ami, for being here, and everybody have a great afternoon.